happy to be here back in Stockholm. I was just telling some of them, it's becoming like my second home. It's my third time here in the last 2 months, and I really enjoy coming back here. Yeah, so once again, thank you to the organizers for having me here today. Just a little bit of background about myself. I'm actually a practicing surgeon in liver, pancreas, and liver transplant surgery. That's still my day job. What started out as a side job has become sort of a huge part of my life. And today, I think what I want to try to showcase to everyone is the journey that we had moving into advanced connectivity, the experiences from my hospital, a little bit of bias from the healthcare side of things of how we look at 5G and the future of advanced connectivity, and hopefully by the end of this session, have everyone to see 5G in a different light and something to look forward to in the future. Right, so this is my hospital here in Singapore. This is not the existing hospital. This is the redevelopment plan that we're going to be doing in the next 10 years, where we're expanding the hospital from 1,000 beds to 2,000 beds, and of course, advanced connectivity being a huge component of what this hospital is going to be. Now, when it comes to healthcare, I think we mimic a lot of what happens in the rest of the industry, where we're moving away from physical systems and then after into cyber systems, and now into the amalgamation and integration of the cyber-physical space. So why do we need advanced connectivity in a place like healthcare? Why is it just simply beyond high bandwidth, low latency, and into the future? And that's because of the AI revolution in healthcare. Same thing as for all the other industries. The healthcare industry has seen an exponential increase in the use of AI in just the last 5 years, not even 10 years, but 5 years. And some of the things that we have seen, for example, the medical imaging breakthroughs. We all know about AI being used to look at X-rays, CT scans, MRIs, and reporting those images much quicker than how a radiologist would, and sometimes even more accurate than a human radiologist. And all that requires a lot of processing, a lot of compute, and of course, a lot of data connection in real time. Early warning system, diagnostic predictions, prognostication systems, patients coming into the A&E being given a prognosis or an estimated diagnosis right from the get-go. These are essentially huge amounts of data being transmitted across the healthcare network in real time. In the past, the bottleneck used to be in the communication systems, right? We had slow communications. We all had that wheel of death when we click on something and we just wait forever for things to appear. Not different in the healthcare sector as well. Connected care or connected health is not a new concept. We've been looking at connected health for the last 10 to 15 or even 20 years. And the wearable revolution, again, is something that essentially has made a huge difference in the health behavior of people. One of the biggest changes and one of the biggest proponents of changes in behavioral health is not anything to do with the hospital. It is not a medical device. It is a consumer device. It is the smartwatches that all of us have on our hands. The smartwatch has changed health behavior more than any other device in the medical field. And it didn't come out actually from the healthcare sector, but again, you require the infrastructure and the background and the back end to support all this in order for it to work. Telemedicine. Before the pandemic, there was some use of telemedicine, but not much. The pandemic actually, increased the adoption as well as the uptake of telemedicine. And now, even though we're out of the pandemic, we are seeing essentially the downstream effects of how telemedicine and remote health and remote medical services can help us improve the way we deliver healthcare to our patients. Surgical robotics, I think some of us have seen, the news articles or the reports and case studies of, surgeons in China operating on someone in Greece and, doing long distance over 5G robotics. Well, it is something more of a use case demonstration at this point in time, but it is a glimpse towards the future of how connected health, integrated health, and how advanced connectivity can serve to break down physical barriers that we have now and to draw the world closer together. And of course, the concept of the healthcare metaverse, right, where we exist not just in a two-dimensional world, but in a three-dimensional world as well, using XR devices, for example, virtual reality, augmented reality, mixed reality for applied surgical anatomy education, right, being able to allow residents, trainees, nurses to see the patient's anatomy in 3D rather than looking at it on a computer screen. And of course, knowledge management. I think one of the biggest change in not just healthcare, but around us is the use of generative AI or large language models. We all have some form of it on our handphones nowadays, be it whether you use Claude, use GPT, all of us have had interactions with large language models. And it's the same when applying it in healthcare, right? How do we essentially build this into the healthcare systems and the healthcare network, make sense of it, integrate it, and essentially have it connect the entire system into a whole and not to build more silos, which is kind of what, unfortunately, we are doing at this stage, where every time we adopt a new technology, inadvertently, we are building new silos. How do we then bring them together? And of course, into the future, the whole concept of spatial AI, spatial computing, looking at data, looking at information in a three-dimensional space, right? Having the AI and the computers and the algorithms that we work with recognize that we don't exist in a two-dimensional plane, right? We exist in a three-dimensional world, or sometimes even a four-dimensional world, depending on what we believe in, right? How do you then get all this together into a single ecosystem and have it to work, right? So that is essentially the thought that I want everyone to hold in your head as I go into the next session of my presentation, and hopefully at the end, we might have a little bit of inspiration on where to go. So how did our story begin when we moved into the whole 5G space, and why 5G? Well, it started with a very simple use case, right? How do we use mixed reality in healthcare, right? When I was a surgical resident, I remember standing at the operating table. It was a very complicated case. And I I told my attending, I wish I had a hologram of the patient's scan in front of me at the operating table so that I can actually see what's going on. And a few years later, we had the opportunity to work with Microsoft on the HoloLens 2 and to apply it in healthcare. So we started using it in a very simple use case, which is to convert the patient's imaging scans, CT scans, MRIs, into 3D holograms, and to use it for surgical planning. Disclaimer, I will be showing some actual pictures and videos from surgeries. There is not too much blood. There is a little bit of blood. I do apologize to those who might feel a little bit uneasy, but yes, do bear with me for this part, right? So we started essentially by changing those CT scans, MRI scans into 3D holograms, right? So this is for one of my patients who was going for a liver transplant. What we did was that we used AI segmentation to identify the different components inside the patient's CT scan, identify them, separate them, colorize them, and this is what essentially you see, right? So we can appreciate a patient's anatomy in 3D now. It's no longer on a 2D computer screen. I can do a virtual surgery before even stepping into the OR itself, and instead of trying to convert 2D images in my mind into a 3D image, we have devices like this to convert it for us. Very simple use case, not much of a requirement when it comes to compute or connectivity. But then we decided to say, okay, let's bring this into the OR itself. So this is one of my colleagues who is using this to teach his resident on a neurosurgery procedure. What you're seeing here essentially is that we're connecting multiple headsets together to look at the same hologram on the operating table at the same time. This becomes more complex, right? You need real-time synchronization, you need real-time rendering of the images, you need real-time stabilization of the images, and this puts a huge strain on the network that we had. We had Wi-Fi, it was hopeless, right? At 11 o'clock, 12 o'clock in the daytime, where you have people watching Netflix for some reason in the OR, watching YouTube, it was impossible for us to use this. So we decided to say, okay, let's give 5G a try And that was essentially our initial inroad into 5G. We looked at it purely as a pipeline for better communication because we didn't understand what 5G was about at that time. We were fortunate enough to work with the regulators and the Singapore government to get a grant. We didn't get all 30 million, unfortunately. We got a small bit of it, but that essentially allowed us to install and to deploy a private 5G network, not just within the hospital, but a private 5G network that covers the entire country. So sort of like a virtual private 5G network. And we used some of that funding to actually renovate the hospital where we installed indoor 5G antennas together with Ericsson in 10 of our operating theaters and 3 of the inpatient wards for our initial phase 1 trial. And it was a long process. These are some of the photos. It took us about 9 months to essentially do the entire renovation in the hospital because this is a working hospital. We could only do the renovations from Friday night to Sunday morning, and after we have to hand the operating theaters back to the OR committee on Sunday evening to prep for the first case on Monday morning. Right, but what we ended up with essentially is a dedicated network that allowed us to have very high speed transmission throughout the day at any point in time, regardless of how congested the network is going to be. Right, so this gave us the assurance that we are not going to experience network failures in the middle of a surgery and not when everyone else is watching YouTube or Netflix for whatever reason in the OR itself. Right, and essentially, we also realized through this process that 5G is a very different technology from any other communication networks that we know of, right? Because 5G is what is called a software-defined network, where essentially you are able to customize your entire transmission from point to point just purely by software and not rely on the hardware transfer points and everything which 4G used to rely on. And the biggest difference between 5G and Wi-Fi is the security. Right, we are moving away from an unlicensed and unregulated network, which is a Wi-Fi network, into a space that's highly regulated, highly licensed, and almost impossible to hack. And this is where essentially we designed our first hybrid architecture together with Ericsson, Microsoft, and a few other partners to essentially allow us to have a very secure data communication channel to enable transmission of identifiable patient data through any device that's connected on this network in real time. Right? This is not possible without a network like this, and this is the first ever network that was approved by the Ministry of Health in Singapore to transmit patient data live through any device that's connected. We didn't deploy this network in the end because we are working on the next generation and because this was way too expensive at that point in time. Yes. But what we did manage to do essentially is to leverage on the 5G network to customize a lot of the solutions that we have, especially AI solutions that were deployed in the hospital. We moved away from physical workstations, for example, high-performance laptops or desktops, into edge computing and cloud computing services because we were able to install our AI algorithms onto the data centers and onto the network itself. And this allowed us to scale because I don't have to carry the hardware or the laptop with me anymore. Right? As long as I'm connected to my enterprise network anywhere within the country, I have access to the AI algorithms that's installed on the 5G network itself. Essentially, the network and the 5G infrastructure becomes part of your AI. It is no longer just a single pipeline. It is no longer just what we call a dumb conduit. You are essentially building the entire processing plant for things to happen. So what it allows us to do essentially is things like this, right? Being able to see the hologram superimposed on the patient in real time, giving us the surgical navigation and the guidance of how to do the surgery, knowing that the system is not going to fail, right? This is one of my patients. This is actually a case of a 9-month-old baby who was going for a liver transplant for liver failure. So we essentially do this routine now where we use mixed reality and augmented reality to do donor-recipient size matching. The yellow object that you see, this is the liver from the mom that was going to the baby. And because of 3D imaging, we know that this liver is going to be too big. Right? We have to reduce the size of the liver during the surgery. But because we planned this before the day itself, we knew exactly how much to reduce the liver. We knew exactly how much is going to be left and whether or not it's going to be enough for the baby. So this is essentially a recording. So I was wearing the HoloLens and recording the entire surgery. And you can tell that essentially we are removing the parts of the liver that were sticking out of the hologram, right? Knowing that this is essentially too big for the baby. And this was the liver inside the child. And this was done 3 years ago. Today, the girl is in kindergarten. She's playing around with the friends. She's leading a normal life. Essentially, a very different outlook in life from what it used to be, enabled by technology. We use it routinely for our thoracic surgeons who remove small tumors in the rib cage. One of the problems that they had was how did they localize where the tumor was, right? And we used to use other ways, for example, using ultrasound, using x-rays, or even counting the number of rib bones, right, in order for them to know where it is. But there is a percentage of error, and there have been cases where surgeons have operated on the wrong rib bone and removed the wrong bone before. With technology like this, it allows us to superimpose those images onto the patient on the operating table, and they know for sure where they're operating on. They will not operate on the wrong space, and because you can wear these devices with the back-end connectivity, we know for sure that this is not going to fail during the surgery itself. So what you're seeing here is actually a first-person view of the surgeon wearing the device as he's operating, and all they do is to make a very small cut, a bit squeamish this part, right, over exactly where the tumor is, right? They go all the way down to the tumor itself instead of making a big cut, right? And once they're happy with where the location is, they simply bring back the hologram like this, and they know exactly where they are. So again, real-time image guidance to minimize the risk of complications, to minimize the risk of errors for our patients on the operating table. Right. We can then also use the network to do additional things. For example, identifying veins underneath the skin. I'm sure all of us have been to the doctors where they tried to draw blood from us, and they're not always successful the first time, right? Especially for patients with very tiny veins, right? With this, right, what we're using essentially is an AI algorithm to analyze the image from the infrared camera on the HoloLens in real time, and it shows you exactly where the veins are. Now, this algorithm is installed onto our data center and the virtual machines in our 5G network, so you can use it anywhere in the country. And of course, live streaming images from medical devices, ultrasound, x-rays, CTs, onto anywhere, either your computer or onto AR devices, this can be done. And of course, into the next stage, which is the incorporation of haptics. Right, so what we're trying to do now is to address some of the components that are missing from XR technology in healthcare, which is the touch. You can see, you can hear, but at the moment you cannot touch it. Right, so with this, essentially what we did was that we worked with the university side to develop wireless gloves with pneumatic bubbles inside where you can actually feel the holograms that you see. So in this case, what they're feeling is a heart beating in their hand, not just for education, for the medical schools, but for patients as well to be able to feel and touch their own organs without actually reaching inside the body. And of course, the whole concept of digital twins, right? Digital twin in the medical space, in this case, we refer it to for organs, right? So there are a lot of interest in the use of virtual replicas and digital twins in the medical space. This is a project that is looking to create a virtual replica of the liver. So what it does is that it uses a technique called finite elements modeling. I think many of you may be familiar with this, to divide the liver into 500,000 individual 3D elements. Each 3D element is given its own biophysical property based on a special elastography scan that is done on the patient. And what this does is that it allows clinicians and it allows engineers to model how the liver is going to behave to external forces, not a random computer simulation, but based on patient-specific data. Right? So for example, in this case, if we apply an external force onto this patient's liver, this is how their liver is going to deform. Right? And what that does is that essentially it is meant to give us real-time image navigation during a surgery. And again, the real-time image navigation for cases like this, it requires a huge amount of compute, and you can imagine the amount of data that's being sent from the camera systems in the operating theaters to the cloud, to the edge, processing it, and come back down. Right? Without a robust communication system, this is not going to happen. Remote medical assistance. We have a project that we are running now together with a charity hospital in Ghana, where we provide remote surgical assistance to the surgeons there in Ghana. And what they do is that they wear the HoloLens and they live stream the surgery back to me sitting in my office in Singapore, and I can guide them through the surgery and provide them the supervision that they need in real time. Right. In Ghana, they don't yet have a 5G network. They have a dedicated 4G network that goes to this hospital. But again, a glimpse into what's possible, right, to breaking down barriers and democratizing healthcare to areas that are less accessible. And of course, that project has expanded, right? Right now, they are moving the network beyond just the walls of the hospital and even into the outreach, right? They are using it for their community outreach, where they have these vans that goes into the villages that's 2-3 hours outside of the main city, and they live stream those images back into the hospital for the specialists to be able to assess the patients out there, because the patients are, have no way of coming to the hospital because of the distance, the requirements at home, they have to work, right? So again, breaking down barriers that would traditionally have hindered a lot of these potential health benefits for the patients. Now that we have understood a little bit more about what 5G can do, we decided to explore what more can we do with the 5G network. Autonomous mobile robots, AMRs, right? These are things that are not unique to healthcare. They are everywhere in the other industries. So in our hospital, we do work with a few partners to develop what is called a robotic nurse companion. So these robots are not surgical robots. They are meant to help the nurse. So deliver medication from the pharmacy, help to monitor patients, and the entire brain of the robotic network, the task optimizer, the fleet management system, rides on the 5G network. Right, so we have essentially a digital twin of the hospital. We have the command and control interface of the robots residing in the cloud, and the robot essentially has very minimal on-board processing requirements because we have put everything onto the edge, onto the cloud, and the whole thing is connected through a 5G network. Home care solutions, being able to monitor our patients at home, right? Having the connected IoT environment for the patients outside the hospital, right? Right now, our hospital home teams, the nurses and doctors who goes to the patient's house to visit them, their tablets are 5G enabled, and they have a very secure channel into the back-end EMR system, right? Purely because they are on the enterprise network and they do not have to compete with all the public channels and all the public information that's going on out there. And of course, the non-clinical side of things, facilities management, right? How do you build an IoT ecosystem to allow you to make sense of all the sensors and all the different devices around the hospital for facilities management, for building management, and how do you integrate them into essentially the next generation integrated network where you have the non-clinical and the clinical components mixing together to build what we think will be a true intelligent hospital and intelligent healthcare system. And we feel that 5G, 6G, I call it XG here because the number is just going to keep going to roll, lies in the sweet spot of 3 essential components that we need, at least in a healthcare system and also beyond, which is security, the platform of which everything runs on, and the ecosystem which we exist in. And the development evolution of the healthcare network, we have moved away from connected health. Connected health is something in the past because connectivity is not the issue. Integration or integrated health is where we are now, where we talk about interoperability, trying to bring all the silos that we've been creating for the last 5 to 10 years into a single platform, and hopefully into the future of true intelligent health with the aid of integrated networks. right, where you have essentially end-to-end bidirectional communication between any device that you have in a healthcare network that communicates directly with the EMR system and updates it live. No intermediary, nothing in between, no security breaches. I think this is where hopefully we will get to one day where essentially everything is on the same network platform ecosystem. And this is how we are designing the network in my hospital, right? We are essentially designing the entire backbone and the architecture of the AI network and the communications infrastructure in my hospital to leverage on the advantages as well as the benefits of having a software-defined network where we can then decide how information is going to flow throughout the entire communication service in the hospital itself. Right? And of course, then we can then build a multi-layer strategy of how we're going to protect patients' data, how we're going to do multi-layer compute, how we're going to organize our data structure so that it makes sense, right? To not just protect everything, but to integrate and assimilate everything onto one single platform, and hopefully move towards a future where essentially the network is not just a conduit. It becomes a critical component. It becomes a core infrastructure in order for us to build towards the future, right? Where everything, for example, in this picture is connected and you have information, usable information at your fingertips at any point in time. So specific to healthcare, right? The clinical IoT ecosystem is something that we've been trying to do for a long time and not very possible with a Wi-Fi or a 4G network. But now, with software-defined networks like 5G, moving into 6G in 5 years' time, this is a real possibility and a reality that we will look towards to in the future. Having embedded intelligence, spatial and embodied AI, looking at robotics, looking at hospital digital twins, XR projects, real-time patient monitoring. These are things that are possible now and essential to be part of the entire ecosystem for us to go towards intelligent health from integrated health. It is important for us to work with the industries, right? Because as a healthcare worker from a hospital, we are not a tech company. We are not an engineering company. We have the use cases, but we don't necessarily have the expertise, right? Which is why we work very closely with our partners, for example, in Ericsson, in Singtel, the service provider, to look at what is the next generation of tech to bring into the healthcare sector to enable us to do a lot of things that we wanted and hoped to do. And of course, looking into next generation communications that will not just benefit the healthcare sector, but across industries as well. Because I come from a healthcare perspective, but I'm sure a lot of us face the same challenges and the same needs and the same use cases as we do in the healthcare sector and everywhere else. There are, of course, a lot of hurdles and limitations. There are multiple layers to all this, the tech readiness being the core of it. But as we expand out, as we move from pilot to trial to small-scale implementation to adoption to scaling, we are going to face multiple layers of challenges. And it's important that we navigate all this in order for us to go from just a good to have, a nice to have, to a must have in our day-to-day lives. We had a lot of issues. These are just some problems that we had when it came to renovating the hospital. Technology is no longer the issue here. It's how do you put it in, right? And to put it into a hospital that's 40 years old, there are various challenges because I found myself climbing into the ceiling and basements of the hospitals on the weekends to decide with the engineers where the cables should run. No one had a blueprint of the hospital. We were quite shocked by this, and hopefully something that we need to address. But again, just some personal reflection on my own journey through all this is that there are going to be a lot of growing pains as we do this because we are essentially the pioneers of the next generation of technology and how the future is going to look like, right? And in the medical industry, I can say this as a surgeon, we are a very stubborn bunch, right? We don't like change. We are very comfortable with what we've always been doing. You go to a very senior clinician and tell them this is new, and they would say, well, I've been doing this for 30 years. Right? I don't need something new. Right? But so getting people on board, convincing them, showing them the value of new technology, of new innovation is something that's very important. Right? And we have to be able to accept that along the way, we are going to fall. There are going to be rejections, right? But at the end, we need to keep in mind what was the original motivation. Why did we do this in the first place? Right? And of course, balancing the dare to fail and knowing your limits. Everyone says when it comes to innovation, there will be failures, right? But I think it is also important for us to know that there are boundaries that we cannot go beyond, because if we keep going beyond it, we are essentially just setting up ourselves to fail. The dare to fail must also be complemented by a strategy for success, right? Which is where knowing our limits is going to be. And I think that balance is going to be very important. And my last slide, hopefully I've given you some thoughts, some inspiration on how advanced connectivity and the future of wireless network is going to change not just healthcare, but in the various industries where all of you come from. And I'll leave you with a quote. This is, well, an adaptation of myself from a quote from Cars, the cartoon animation from Disney, right? Do not fear failure, but be afraid of not having the opportunity to succeed. Thank you very much.
Thank you. Wow, thank you. 10 years ago, cars was everything in my life. My then 3-year-old was immersed in that world.
That's
so
right.
Thanks for that reference.
Thank you. Still my favorite animation.
Yeah, I agree. I agree. So, I totally forgot to remind you that you can use the app to ask questions to our keynote speakers. So please do that while I'll start. I just have to ask one question. You mentioned 4D. Depending on what you believe in, so 3 dimensions or 4 dimensions, depending on what you believe in.
Right.
What do you know that I don't know about the 4th dimension?
Well, I mean, in my case, or the way I see it, is that the 4th dimension essentially is time, right? Because a lot of times what we're looking at in terms of data, we do look at longitudinal data, but that is essentially, a lot of it is historical. Right. What we're missing is how do you then look at time in the present and time in the future, which is the predictive analytics. Right. Predictive analytics have been around for a long time, but most of it is based on big data. It's based on number points. You essentially plot a graph and you see how things are going to go in the future. But I think when it comes to spatial AI, time and space becomes a little bit different. Right. I'm not a physicist or theoretical analyst, but if you look at, for example, some of the research and studies when they look at for example, theory of relativity, right? When they look at how time and space can bend, right, as things change, and how this is going to affect essentially what happens today.
Yep.
Right. I think that's an area where spatial AI has a lot of potential and a lot of power in, not just in physics and science, but in healthcare and in medicine as well.
And speaking of the predictive part of this, because obviously predictive AI is sort of one of the big promises within healthcare, but also other spaces. And at the same time, it's in some fields being discussed, sort of mentioned as the new snake oil within AI, that we think that AI will be able to support us a lot when it comes to prediction,
Right.
but it's so complicated because
Yes.
of all the factors that are sort of included in the predictions that we make, and everything changes, and the human factor and everything. What's your point on that?
Right. So, I mean, sort of my views might be a little bit biased from the healthcare perspective, but the way I see it is that healthcare has been using predictive analytics for a long time, right? In the past, we used mathematical models to try and create prognostication scores, all the scoring systems and everything. And it is not different from how we intend to use AI to do the same, right? What I tell people is that AI is a different methodology of doing something that we've always been doing when it comes to predictive analytics. Right? It is still based on science. It is still rooted in basic mathematics. It is still to do with formulas. It's just that now we can do it a lot better, a lot faster, and at a much bigger scale. Right? So, I mean, just for some examples, like I work with, I specialize in the pancreas and everything. So we've been using predictive analytics for pancreatitis, inflammation of the pancreas, for the longest time. Would you like to hazard a guess, right? Before AI, the predicted or the prognostication scoring system that we use, what is the percentage in predicting the the severity of pancreatitis or the accuracy that these scoring systems can predict how bad the inflammation was? Just give a percentage.
Before AI,
Before AI.
20%?
A little bit better. Yeah,
Okay.
so it's about maybe 60%. Yeah.
How
but
many?
60.
60, okay.
Yeah, correct. So the question is, if we are willing to accept 60%, right, as part of our standard medical care for the last 30, 40 years, right, why are we essentially putting extra scrutiny on AI when AI is able to give us 90%? Right? And I think a lot of that comes down to essentially understanding education and how we bring this into the educational pedagogy for, and in my case, in medical school, right? Because in medical school, from the first year to the fifth year, we are essentially exposed to what we call evidence-based medicine. We are taught statistics, we are taught how to use stats in analyzing healthcare data. But before this, we were never taught how to use AI to analyze healthcare data. And I think a lot of that sort of hesitancy is purely because we don't really know how to use it and we don't really know how to appreciate it, right? So AI definitely makes a lot of things better than what it used to be. The complexities are there purely because we can handle those complexities now, right? In the past, when we look at prognostication scores, so for example, the pancreas one, I can only, the scoring system only looks at 7 variables, right, which is why the prediction is 60%,
Yep.
right? Because the mathematical models back then, or even now, if we use traditional stats, to account for, let's say, 200 variables, it is just almost impossible, right? And it would be impossible for the clinicians on the ground to input 200 variables for one patient coming through the ER just to get it done. But with AI, with automation, with collecting data autonomously and automatically, and being able to put 200 variables into one single model, we can essentially account for these complexities. But then, essentially, then people may say, oh, but there's too many.
Yep.
Right? So I think finding that sweet spot is kind of where we have to be. Yeah.
Great answer. So we have plenty of questions from the audience, some great ones. So while the connectivity is seemingly solved through XG, these algorithms still require, of course, large and varying amounts of compute. How do you ensure that the compute is also being performed in a safe and regulated way?
Right. So this requires essentially a lot of coordination and collaboration with the industry side. Right. So the way that we use the compute is essentially we can decide where and how we want to use it. So for example, in our case, we work with the telcos to use the virtual machines and the GPUs on their data center to do a lot of the compute they require in real time. So we work with them for the service contract. We are guaranteed a certain amount or quality of service at any point in time. We can also essentially look at cloud computing or even leveraging on supercomputers to analyze and access the data that we have, right? But I would say that the compute is in a way always trying to play catch up with the requirements. I mean, for those of us who have played computer games before, we are upgrading our GPUs every single year, right? Because the graphics just get better and better and better and better, and the compute is catching up. A large part, again, is about finding that sweet spot, right, between fidelity of the algorithms and what is practical. Right? We can have very heavy algorithms, very complex algorithms that give you like 99.9999% accuracy, but it's impossible to use on the ground because you can't run it on real time. Right? So where do you find that sweet spot to say, okay, I reduce it to 99.9? Right, and not 99.59. But now that 99.9, although it's not as accurate, it's a lighter model or lighter version of the AI algorithm, but it allows me to use it on the ground at this point in time, right? And if and when compute catches up, then we see, okay, maybe add on another 9 or another 9. Right, so I think a lot of it's about the balance, right? The pursuit of excellence in engineering versus what's practically on the ground given the resources that we have.
Yeah. So we actually have to wrap up, but I have a great question here. A simple question, but also complicated question. So as quickly as possible, if you can respond to this, is there anything within your field that AI would not be used for that humans will have to keep doing?
Well, I would say patient counseling. Yeah, because I think it is still important to have the human touch when it comes to, for example, breaking bad news, right? Or being there to comfort a patient. I mean, I'm sure none of us would want a robot to come to us and tell us a very bad diagnosis, right? I mean, the robot will function in certain aspects of counseling, but I think in the very crucial human-to-human interactions and a very crucial human-to-human contact, and when you need a warm hand or a hug, right? That's when a robot or AI cannot replace. You need a human.
Great. Let's wrap up there. Thank you so much, Dr.
Thank you.
Gao, for coming
Thank you
to
so much.
Sweden once again.